Most people stop care right before the important changes actually happen. And it's one of the biggest reasons why chronic pain, neuropathy, and migraines tend to come back. Hi, I'm Dr. Rebecca Gibbons with Acupuncture and Wellness in Pensacola. Today, I want to talk about something that determines whether people get short-term relief or real long-lasting results, and that is treatment plans and maintenance care, especially for chronic conditions. So if somebody comes in with something acute like a recent muscle strain, that's often simple and short term. We may see them just for a couple of weeks, but chronic conditions are different. Something like chronic pain, sciatica, arthritis, migraines, neuropathy, and infertility, these develop over years. They involve the nervous system, the circulatory system, inflammation, and tissue degeneration. They do not correct in 1 or 2 visits. That's why we use structured treatment plans instead of just random visits here and there. A real treatment plan is designed to actually calm the nervous system, improve blood flow and tissue health, reduce inflammation, restore signaling between the brain and body, and build changes that actually hold for a long length of time. So I like to see my patients a lot in the beginning, and then afterwards we just may see you for maintenance. Early in care, most people notice relief. Pain decreases, tingling reduces, and this is the phase that everyone loves. That is not the finish line, though. Almost every chronic case reaches a point where patients say, "I'm better, but I'm not where I want to be." This is what we call the plateau phase, and it is completely normal. I see it with sciatica, patients who are 50 to 60% better but flare with increased activity. I see it with neuropathy patients whose burning improves but a significant amount of numbness remains. I see it with migraine patients whose headaches are less frequent but still triggered by stress or certain foods. I especially see it with fertility patients whose cycles improve, but conception hasn't happened yet. This is where the plateau phase is where people get really discouraged. And this is also where the deepest neurological and structural changes are happening. So symptoms often improve faster than the underlying dysfunction. So when care stops too early, the body usually drifts back into the old pattern and the condition returns. Plateaus are not failure. They are a sign that the body has stabilized enough to begin a deeper repair. The biggest wins I see rarely happen in the first few visits. They happen when patients stay consistent, just like anything in life. The neck pain patient who suddenly realized they can turn their head without thinking. I have neuropathy patients who notice better balance and fewer nighttime symptoms like burning and tingling. And I see low back patients who return to walking, traveling, and daily life. So these changes are built all over time. It's just like retraining the body for a marathon or muscle, increasing muscle. It doesn't happen overnight. So once we reach your goals, the next step is, how do we keep them? Life doesn't get less demanding. Stress, aging, work strain, old injuries, and nervous system overload tend to continue. So maintenance care protects what you've worked for. It helps prevent relapse. It helps support the spine and nervous system. It manages inflammation and it catches early problems. It also keeps the body adaptable instead of reactive. Patients on maintenance aren't starting over. They're staying ahead. They're keeping ahead of the game. So a clear plan, enough time for real change, support through plateaus, and ongoing care to protect results. That's how people move from chasing relief to regaining function and independence. So if you're currently in care and feeling stuck, ask where you are in the process. If you've stopped and symptoms are creeping back, that's your body telling you it still needs some support. And if you're dealing with a chronic condition and don't know where to start, we're here to help, or find an acupuncturist in your area. You can visit us by visiting awpensacola.com or call the clinic at 850-530-1028. If this is helpful, either comment or subscribe, and we hope you have a good day. Bye.